Okay. Can you all hear me fine, Berta?
Yes, ma'am.
Yes, we can.
Yes.
Okay. All right. All right. Well, good afternoon. Thank you all for joining us. Thank you, employers and any partners that are participating on this call. As we are starting to develop our plan for the next few years, we wanted to get some input from you all so that we can go ahead and meet the needs of of all the employers that we have here, in particular with the medical industry. And so with that, I'll turn it over to Margie Cintron, who will lead us into a PowerPoint presentation. Margie?
Thank you. Yes, and I saw Julie on the call. Julie and I met through the Census Committee. Hello, Julie.
Hi, Margie. It's a pleasure to see you. I hope you're well.
Thank you, you too. So if we can go on to the next slide, and I appreciate whoever's turning the slides for me. Okay, well, go back one slide. There you go. Okay, what we're here working on is the strategic plan that has to be turned into Texas Workforce Commission by the South Texas Workforce Board. That plan is due on March the 1st. Included in the plan are target occupations, a list of target occupations. Currently, there's 27 occupations on that list, and these are occupations that have the most demand for employment. Those occupations on the list also qualify for individual training account training monies and other strategies that would help the workforce pipeline do what it has to do to meet that occupational demand. So we're going to talk a little bit about the occupations, but we're really going to talk about the occupations in the healthcare industry. And we're looking to have more conversation than my voice. So I'm going to give you some background, and then I'm hoping to bring you into a conversation. So let's move to the next slide. Okay. And then go on to the next slide. What we're going to talk about is South Texas, and the region that we're looking at is a 3-county region that includes Jim Hogg, Webb County, and Zapata. And when we pulled the data for these 3 counties that make up South Texas, the data is showing, as you can see in the top line of this table, currently, or not currently, in the base year 2018, this data that comes from TWC, Texas Workforce Commission, says that in 2018 there were approximately 114,774 people employed in those 3 county areas. That number is projected to grow in 2028, as that top line reflects, to 134,325. That's an increase of almost 20,000 new jobs, not jobs that are transferred. As you can see in that same table on the top line, it does tell you about the exits and the transfers and how much percentage growth. So in the South Texas area, between the 10-year period of 2018 to 2028, there are about 20,000 new jobs that are projected to come into this area. Now you can see that that base year is 2018, and the information or the data is not inclusive of COVID-19 effect. So we're going to go on and we're going to look at the healthcare occupations. So let's go to the next slide. In this slide, this is showing you the current target occupations that are considered healthcare that are on that target occupation list. The LVNs, the registered nurses, home health aides, nursing assistants, dental assistants. See, this is about the healthcare industry occupation. These numbers reflect these are health. uh, industries in the area. So, for example, that's projected for the EMT conditions. And registers, there's a projection of 257 new. So let's go on. The next slide, please. What we're trying to see in this, because I think she's having problems connecting to the internet. Someone is. There you go. Now we go back to go back, please. There you go. Okay. In this table right here, I pulled all of the industries that are considered in the healthcare industry sector. Now, in order to get data from the industry, there has to be more than X amount of employers. And so I did pull this, but I had to do something different to capture hospitals. So in this table, these are the main industries or the main sectors under the healthcare industries that hire the most of these particular occupations. So if you look at 6211, the offices of physicians, they're the ones that hire the medical assistants, medical secretaries. Those are from our target occupation list, for example. There's office of dentists and then outpatient care centers and home health care services and individual and family services. You can see the projection numbers there and the percentage changed. Any questions about this data so far? Okay, let's go to the next one. When we were looking at the slide that showed the target occupation list, I couldn't find data per se for the LVNs. And so I pulled the data, and you can see here in this table, the number for the hospitals, 622, reflects a higher sector. I had to go to a 3-digit code for industry, but this is the data about hospitals. They are the ones that employ the LVNs, but you can see in this projection that for the hospitals, they're projected to decrease by 8 in 10 years. They do hire the healthcare support occupations and management occupations, medical and health services managers, which is the managers are showing to have a 0 growth. So the hospital industry isn't reflecting as much growth as some of the other healthcare. Next slide. When I was looking at this data, I was looking at the registered nurse and the LVNs and where they work, since the hospitals were showing a decrease of 8, for example, for the LVNs. I pulled, and the sector that the LVNs also have a large number employed is the ambulatory healthcare services. They're showing that they're going to increase by 28 new LVNs in 10 years. The registered nurse, as we learned in another presentation, does have a good representation in the elementary and secondary schools, as well as some healthcare sectors. Those are the LVNs and the registered nurses. So let's go to the next slide. And then we're going to go on to the next one. on slide 11. We wanted to see what we could see about the COVID effect. And so I was, just playing with the numbers a little bit here. And this is showing from January of last year, 2019 through September. These are the help wanted ads, and these are the top 25 occupations that were in the health wanted ads. So I wanted you to see this table. And the occupations on this table are pretty much the same occupations as I'm going to show you in another reflection of this 25 top occupations. In this table, the occupations stay the same for the most part, but when I pulled the data for the next table that I'm going to show you, I did it with the beginning of COVID, March 2020 through September, the latest date. And I saw that the difference in what you're going to see in the next table, in this table for the highest occupations where there's more want ads than others, is these two occupations, or really three in the blue. You can see two of the occupations that show up in the top 25 occupations between January and September. Two of them are healthcare related occupations, and physicians and surgeons, and medical and health services managers. Now look at the number of postings. There's 32,195 postings from January 2019 through September 2020. The yellow registered nurses and LVNs are shown because they're on your target occupations currently. The nursing assistants are also there in the top 25 in this period, but they are not on the target occupation list, but they are in healthcare. Let's go to the next table. In this table is where I pulled the data, see, from March 2020 to September 2020. Again, the yellow are the target occupations, and again, you can see that the registered nurses and LVNs show up. You can also see that the two occupations that we saw in the previous table are no longer there. These numbers, occupations are, for the most part, with the exception of the three that I showed you, are the same. The numbers, as I showed you before, in the period that we looked at the table before, the number was 32,195 postings. You can see that in the period in COVID, the postings decreased to 13,874. A very big indicator. Although they did decrease, the number decreased, for example, on registered nurses in this COVID period, and that's what I'm going to call it. They were asking, or ads were asking for 1,320 registered nurses. And the period that we looked at before, there were 3,300 nurses, registered nurses, that were being that want ads were being requested. For the LVNs, you can see in this table that the want ads in this period reflect approximately 344 occupation listings for the LVN. In the table that we looked at before, there were 712. So the numbers that are in the want ads, it's a very big indicator that the 13,874 is a significant decrease. It's a 4,044 decrease in the number of want ads that we're seeing with the COVID period and what's going on. And so with that said, that's a very big reason that we need to have this conversation today. You can see the data that we are looking at is a base period of 2018 through 2028. You can see that the want ads are showing a decrease in the number of jobs that are being posted. And so for that reason, we're going to go on and do what we really need to do, and that's to seek local wisdom. So let's go on to the next slides, please. And the next one. There you go. Okay, with that said, we're hoping to have some conversation, and we put these questions out there, and now it's time for you to offer us some insight based on your expertise in the healthcare industry or other industries. If you'd like to share, what we're asking you is, what is your opinion about the demand occupations, especially the registered nurses, the medical assistants, and all the LVNs and all the other ones that you saw in the projections? Do you feel that your company has other occupations or skills or training that's needed? I'm not sure who's on the call that's from healthcare other than Julie. But anyone's welcome to jump in here.
Good afternoon, everyone. This is Erica Martinez from the City of Laredo Health Department. Thank you so much for this important information. Like you said, due to COVID, things are rapidly changing, especially in the arena of public health. We do see Laredo has always been a community that is medically underserved, that requires additional assistance and coverage with medical professionals, doctors and nurses, but more so at this time. We also see an increased demand for our laboratory technicians, our medical technicians that can run the tests in laboratory, especially with COVID. We do see the demand for registered nurses, for licensed vocational nurses, and epidemiologists, those that track and conduct surveillance for any type of infectious disease. And of course, we did see a spike in demand of contact tracers. We did execute a plan to provide immediate training to those that were displaced, from their jobs due to COVID, provided training through the Johns Hopkins University on what it entailed to be a contact tracer. And we started recruiting in that manner. But this is not going to go anywhere, unfortunately. We need to continue monitoring. If it's not this pandemic, we've seen it in the past with H1N1, with SARS, with Ebola, with Zika. There's always going to be threats to our community, and public health is always at the front line waiting to respond.
Erica, thank you so much. That's a real big contribution. Let me ask you something. You mentioned COVID related, like contact tracing and others. So you're using existing employees and upgrading their skills to be able to provide this service? Or are you hiring new people and bringing them in and getting up the learning curve? How is that happening?
Due to the demand, we did have to do a combination. As we have said, there has been job displacement due to COVID. People, as some of you might be aware, some of our facilities with the City of Laredo were shut down through a period of time. So we did transition some of internal employees into these contact tracing activities, but we also had to hire additional support. We did see a high spike in demands for contact tracers, which we called public health investigators, and also medical office assistants. So we needed people that were trained to take vitals, to register, to provide results, but that have that clinical background, that would be able to even do the nasal swabs or oral swabs for testing, and have all that training. So we were working closely with Laredo College. I know they did provide some training with their medical assistant program, and we're trying. It's been difficult. The demand is everywhere. So in recruiting for registered nurses, medical office assistants, we had been seeing. And of course, the apprehension of our community. We do have, I've always said that our programs here in Laredo are top notch. Our registered nurse programs, both in BSN, RNs, and TAMU, now with LC, we have amazing programs, but with COVID, there also came that hesitation of being in the front line. So we did have medical assistants that would go through our recruitment process. We were granted an offer and then would decline because of their apprehension. So we understand, we take all measures that possible. We provide all adequate personal protective equipment and ensure that all safety precautions are followed to make sure that they're safe.
Thank you. Julie,
Thank
do
you.
you have something to add about the in-demand occupations, especially the registered nurses or?
Yes. Well, first of all, thank you for having this meeting and for welcoming our input. And I do want to echo what Erica just mentioned. Working with the healthcare providers in our community and the hospitals, it is evident the number of medical office assistants and LVNs that are available, especially right now, because they are being utilized to support not just the clinic itself, but even the medical doctors who during these times are having to see their patients via the virtual platform as well. And so a lot of them from firsthand experience really do not have that support within their office setting. So besides the healthcare professionals that Erica just mentioned, I would like to say that we need some training for our healthcare providers or their support staff to utilize technology to provide the services so much needed, not just right now, but from this point forward, because we really don't know what lays ahead or what's going to come around the corner. We do not want to be in a situation where we can't move forward. And there's only so many individuals that are feeling comfortable with using the different platforms for providing services. And I think that that's one area that our agency for sure was thinking about. How can we overcome this hurdle? How can we provide that service for them to be able to deliver a service that is so much needed, because people can't wait to be seen face to face. A lot of these, as you know, Margie and Erica, a lot of these people are dealing with issues like diabetes, heart problems, and they have to see their doctors on a regular basis. So we cannot go without seeing them. So how can we improve the providers having the ability to deliver those healthcare services to the individuals virtually if we do not, if they don't have the necessary skills or their staff does not have the necessary skills to do so?
For existing employees to upgrade them to have
Yes.
okay. That's an important, the number challenging. It's that great
Yes, it is.
need for the healthcare workers. Thank you very much. That's an important point. And that is something that we can strategize and work together on. Let's go to the next question. I think we've gone over this. Is there another healthcare provider that the staffing need? I heard Erica talk about, a lot of COVID related staffing. And I heard Julie talk about, the existing staffing and the upgrade need of technology. So are there other strategies that we should look at that is impacting the healthcare or public health industry?
I don't know if this would fit under this particular question, but I do want to go ahead and voice it. At a recent meeting with the institutions of higher ed that are responsible for graduating the nurses and LVNs, both RNs and LVNs, their faculty, there's a limit in their faculty and the budget that their schools have. And they really shared how we could. Yes. Can you hear me? Okay, I'm sorry, Margie. I see your screen kind of has a delay, so I don't know if it's your internet or mine that is acting. Do you see me, Erica? Do you hear me, Erica? Yeah, Margie, I think it's your internet. But
Yeah, I
I
hear
think it's you, Margie. I think it's you because I can hear Ms. Bazan pretty clearly.
so I'm gonna say it and then I can type the message for Margie to hear it. But I was talking about the number of faculty that are available. Can you hear me, Margie?
Yes.
Okay. The faculty members that are available at both the college and the university, in a recent meeting, we discussed about how they could increase the number that they are currently graduating if they had funding for an additional faculty position. And so I've always said that, you know, if the city or the county or somebody that has money could make that commitment, and it could be several agencies coming together to fund a faculty position at both institutions, that would increase the number of people that are graduating each year, which means that the number of practicing providers would definitely be increasing. And I don't know how, like I was saying, I don't know if this fits under this. If we can identify resources to supplement or leverage the resources at the institutions that are graduating these healthcare providers, our counties would be able to serve more people, and the access to healthcare would be better.
That's certainly a good strategy to consider, because healthcare and the registered nurses has always been a challenge. Can you hear me, Julie? You're good?
Yes, yes, yes. Yes.
And that's a great contributor. That's a contributor, because we need to bridge that gap. The number is large for the nursing occupation. So let's go to the next slide. And this is a little bit of what you're implying for the next slide, slide 16. Go to slide 16. Are we still on? Let's go to the next slide. Am I frozen? Oh, there you go. The other way. Other way. Andale. There you go. Okay. We have a lot of programs that we have in place, but we certainly always looking for other to provide training, and the workforce is about job placement. But in order to make that job placement, we've got to get the person that's interested in that job to be able to have the training to meet the employer's expectation. So we have some of these programs that we certainly would like to see if you're interested in participating, especially with the healthcare related. We have work experience for people. We have internships. We have on-the-job training. We even have pre-apprenticeship. These are concepts and programs that are in place, but we're always looking for other programs, because ultimately we're about job placement. And so we want, Julie mentioned some programs that could be considered as other strategies, especially if they lead to employment. So we are wanting you to be aware of these programs and to consider participating with the workforce to do what we have to do to get these participants to meet the employer. To Erica at the city, what she needs to have to be able to meet her work environment challenges. So these are programs. Are you familiar with them, Julie?
Yes, as a matter of fact, we participated in the teacher externship programs, as well as internships, student externships, shadowing, mentoring. I think one time or another, we've supported each one of the initiatives. So we're very familiar, and we want to continue supporting them.
Wonderful. Thank you.
And we City of
certainly
Laredo Health Department, we're also very familiar with many of these programs and have been fortunate to participate, and even to report that from one of the work experience that was made possible for an individual with special needs. He's actually one of our contact tracers at the moment. So we do tap into this valuable resource with individuals that have gone through our facility and have received some sort of training, we do revisit that when an opportunity does become available.
Wonderful. And these are programs, that are placed. So, like Julie, the concept that you were talking about, it is possible, to consider some of those strategies. Again, like I said, is if they lead to a job placement. And you mentioned, graduates that are ready to be employed. So that's certainly a perspective that we welcome, because yours is a unique perspective in that it comes from a healthcare perspective. Let's go to the next slide. We talked about strategies, Julie, that you mentioned. We do want you to know we are going to note those, as well as Erica. Erica, we see that you have a great need for contract tracers or others in that public health. Certainly, especially if it's over a certain number, to upgrade skills. Those are skills development grants that now the boards can apply for. So there's resources. We just need to identify how and what we need to do to get people properly trained for a real job. And so let's go to the next question about the impact of COVID-19. Erica was very, very instrumental in giving us some real insight about that. I saw in some of the data that I looked at that there are some employers, especially in the survey responses, that are looking to try to get some additional training for people on COVID-related activities. In the survey we are hearing from other industries, transportation, about the effect of COVID-19 on their employees. So I think Erica was the one who said that things are going to be different, a lot of virtual and technology training needed. And that's what we really need to hear so that we can strategize properly to meet the expectation. So I'm going to leave it to y'all to fill in here.
Well, I'll definitely echo what Ms. Basan said about the increased need for technology as well. If you think about it in the scope of the employer, it's very difficult to change a mindset of organizations that have for many years since their inception worked a Monday through Friday, 8 to 5 in a physical office. So a lot of industries are finding it challenging to convert into these virtual work from home, what that means for their employees and for their organization. In addition to that, I think that something that in general would be beneficial to any industry is additional training in disinfection methods, and to learn what is best to keep all of us safe. And the donning of PPE. We're in a place right now in our community that it's very important for us to wash our hands, to wear our masks, but we need to wear our masks correctly and wash our hands correctly. So having even that training, that basic training, would be valuable to any organization.
Thank you for that. Julie, would you like to add anything?
Yes, I do support Erica's comments, and I would like to extend that because she mentioned, sanitizing the workplace and learning to do it properly. But I do want to take it a step further. I think that in order for us to stay healthy, it includes our workspace might be our home. So how can we enhance that, knowing how to sanitize our work environment? That includes our home, our corner in the kitchen, or whatever that might look like for different people. Because in reality, if our family's not well, then we're not well. I don't care if we don't have COVID, but if somebody in our family does have it, then it's going to impact our state of mind and our mental health, and we will not be able to function. So how can we maintain that mental health? One of the ways that, in my opinion, I think, is to ensure that our family is healthy, that we're doing everything in our power to make sure that they're they're going to stay that way. And that includes sanitizing our work area, practicing good methods as recommended, and just taking that over to our different social circles, because knowledge is power. And if we don't share it, it's not going to be good for our community. So I'm a firm believer that if we learn something, we need to share it with at least 10 people and it'll trickle down. That's been my experience. And I think, why not share what we have learned about COVID, whether it's how to prevent it, how to ensure that our families kept safe from it. So I would extend that training to the home, which has now turned into the work environment for many.
That's a great contributor there, Julie. I hear what you're saying. You've offered a lot, you and Erica, technology, the virtual transition, the PPE, are certainly prime activities that need. So let's go to the next survey question.
Before we
Please.
move forward, and before I forget, Ms. Bassan brought up a very critical point during this time. And it goes without saying for us that handle or are in the public health or healthcare professions field and arena, but mental health is also something that's critical. We do see COVID fatigue, we see depression, we see stress, we see anxiety, because of all the contributing factors with COVID. It's not only whether or not you get the disease, but it's whether you lose your job because of it, or your industry shut down, or you're reduced in hours, and economic effect on this. So mental health is so important that there is going to be, again, our communities underserved in this area. There is going to be a need for licensed professional counselors and social workers. We have great programs here. It's a matter of retaining that talent within our community. And I agree with Ms. Bassan, is creating those work opportunities, but it is something that is going to need to be looked at.
Thank you. That's a great contribution, Erica. Thank you for mentioning that. You're absolutely right. The fatigue will affect the mental health of the community. Let's go to the next question and see if there's any other comments or suggestions for the plan. Go to the next slide, please, so that you know what's going to happen in the next slide. We're going to work that target occupation list. Remember that target occupation list is part of the plan. We've got the registered nurses on there, and we've got the LVNs, we've got medical assistants and medical secretaries, as well as EMTs. We're looking at those. We'll be looking at the projections. For the most part, they look like they're projecting a need. So they'll probably remain on the target occupation list after listening to y'all and hearing what your position is about the need for those occupations. So we're going to finalize that target occupation list. And again, like I said, those are occupations that thereafter would be able to be considered for resources, for training dollars, for activities, for strategies. So that's why we need to get this list as close to real as possible. We'll perform data analysis on career pathways and opportunities for those target occupations so that we can share those with persons making decisions about careers. We'll develop that strategic plan. Then we'll put it out for public comment. We'll have to take it before the chief elected officials and the board for approval, and then we'll submit it. That's actually supposed to be March the 1st to the Texas Workforce Commission, and that'll be the plan that will be in place at least for the next 2 years. It is a 5-year plan, but we revisit in 2 years to make sure that those occupations are this is every certainly time and help today. You've been a big help to helping us get the healthcare industry closer to look like what you're sharing with us. So again, thank you for your help and your time today. Believe you me, you guys have been a real big help. So I'm going to ask Sandra to come back. Is Sandra there? Sandra? Mr. Trevino? One of you, Sandra or Mr.
Yes,
Trevino?
good afternoon, guys. This is Rogelio Trevino. Thank you so much for participating, Ms. Basan and Erica. Your input is fantastic. And as Sandra mentioned at the beginning, we utilize all this information to develop our strategic plan and to use this. Our board then authorizes us to invest training dollars in these occupations and to develop these skills that you guys have mentioned as being necessary for our community. We really appreciate your participation. It helps us so much to have input from the people that are directly involved in the field. So you have our ultimate gratitude, and we look forward to continue working with you. We really appreciate you as partners, and we look forward to continue working with you in the future. So thank you so much.
Thank you again. Bye-bye.
Thank you, everyone. Thank you. It's good to see you, Margie and Erica, and hear Rogelio's voice. Stay safe, everybody. Happy Thanksgiving.
Happy Thanksgiving
Always
to
a
you.
pleasure to see you even from far away. Always a pleasure, and we look forward to further discussions. Thank you for all you do, and please stay safe. Happy Thanksgiving.
Thank you.
Bye-bye.
Happy
Bye.
Thanksgiving.
Gracias por todo, no me pidió